All right, I'm back. You see, these are a month's worth of bills. Can you see these? From my health insurance company. Bills from doctors telling me I owe them money even though I never visited them. Bills that I've paid to health insurance companies, to hospitals, to labs. They keep coming in. And they go back 2 years from when I had kidney stones. You see this guy? This is my congressman, Jerry Nadler. And you see what I'm going to do? What I'm going to do is I'm going to take all these bills, all these statements that I don't understand, right? And I'm putting them in this manila envelope, and I'm going to mail Congressman Jerry Nadler all the bills, the notices, all the letters I receive from labs. And I'm going to say, Dear Congressman Jerry Nadler, please figure this out for me. How is it possible for a doctor to charge $1,000 for a scan of my kidney, but the health insurance company is only willing to reimburse her $200 for the same scan, and somehow I'm on the hook for $50? Explain that to me and then pay it. Congressman Jerry Nadler, pay these bills, because I don't even think I owe them, but pay it. And the way you pay it is by fighting for Medicare for all. Now, what are you doing with your life if you're not fighting for Medicare for all? What are you doing in Washington, D.C. if you're not fighting for Medicare for all? The number one cause of bankruptcy in America, medical debt. So this is what we should all do. Take all your medical bills, take all your statements from health insurance companies, your collection notices, take all your letters from your doctors, put them in a manila envelope and mail them to your member of Congress and ask them to explain what all this is. And then demand Medicare for all. And here's the important thing. You can't have Medicare for all unless you put health insurance companies out of business. Medicare and Medicare for all can't coexist with health insurance companies. Health insurance companies together earned about $1.2 trillion last year. That means they spend billions on lobbyists and campaign contributions to bribe members of Congress. So they say things like, health insurance companies are job creators. We don't want to meddle with 1/6 of our GDP. We must protect the health insurance companies. Well, here's the truth. Health insurance companies provide nothing other than paperwork. They suck $1.2 trillion each year out of health care and give back nothing. They only take. They cost doctors, patients, and loved ones billions in lost hours as we try to navigate their purposely Byzantine payout structure. The business model for health insurance companies, the business model is maximize profits by minimizing health care. It's evil. Health insurance companies are evil. And no other country in the industrialized world allows their citizens to be treated in this manner. And don't tell me it's the free market. Because when you look at where most of the revenue for these health insurance companies come from, it's from ripping off Medicare and Medicaid. Let me repeat that. When you look at where most of the revenue for these health insurance companies come from, it's from ripping off Medicare and Medicaid. Even the Wall Street Journal, the bastion of capitalism, has done a series of investigative reports as recently as last week, showing that the business model for health insurance companies in America is stealing from Medicare and Medicaid by charging the government for services never provided. That's not the free market. That's kind of like a hybrid kleptocracy socialism for the very, very rich and immoral. Obamacare works until you're sick. Obamacare works until you need it. Obamacare is like a gun. You think it keeps you safe, but then when you need it, you have no idea how to use it, and you end up dead. 60 million Americans still don't have health insurance, or they have health insurance but can't afford to use it. Obamacare is a disaster. It's a disaster. The election is over. I'm a loyal Democrat. Obamacare, we can say it now, Obamacare is a disaster and a love letter to the health insurance companies. Health insurance companies destroy us. We're forced to stay in soul-crushing jobs because our government has tied health insurance to our bosses. So we put up with crap from our bosses. We work extra hours and don't demand overtime. Can't make trouble because getting fired means I lose my health insurance. And so does my family. It's no way to live, but it's a pretty effective way to die. 65,000 Americans are killed each year because health insurance providers slow walk the prior authorizations for their treatments. So, I want everyone this morning to take all the medical paperwork, put it in a manila envelope, and mail it to your member of Congress and say, explain this to me. Make sense out of all this, and then give me Medicare for all. I'm not sure doing this will solve anything. I'm not sure it will get us Medicare for all, but it's way more effective than shooting a health insurance CEO. This is the Mop Up for December 10th, 2024. I'm David Feldman in New York City. Thank you so much for finding me. Please share this episode with your friends and hit the like button so I remain in your feed. And I think that covers everything. And check out the garbage over at shopdavidfeldman.com. So I'm going to say a few things about the killing of that health insurance CEO. Apparently, a lot of Americans don't like health insurance executives. I had no idea. So let's get something straight. I thought it was unnecessary to tell people this. You don't shoot healthcare executives. You don't shoot anybody. Doesn't accomplish anything. And I'm not interested in who they arrested and what his motive is. That's a distraction from Medicare for all. What is his motive? What did he write on the bullet? Why should we care? Is it going to get us Medicare for all? Why are we covering this alleged shooter when we should be discussing and covering and arguing and debating Medicare for all? This is just pornography. So I'm going to say a few things about UnitedHealthcare. UnitedHealthcare is an insurance company. It should be called United Health Insurance, and the Federal Trade Commission should crack down on it for mislabeling itself. UnitedHealthcare calls itself a healthcare provider. Again, it's an insurance company that doesn't provide healthcare. It prevents healthcare. I'm not being cute here. That's its business model, to deny Americans health care, not provide it, to deny it. I was getting my show ready early Wednesday morning when news broke that a UnitedHealthcare CEO got gunned down in the streets of Manhattan. Brian Thompson was 50. He spent 20 years working for the company. He just became a CEO 3 years ago. What can I say about him that hasn't already been flatulated on social media? I do confess I was stunned by the visceral public reaction to his shooting. Seriously, I was stunned. As someone who has railed against the greed of healthcare CEOs for years, I found myself confused by the righteous delight that so many Americans took in the death of this guy. And as I pored over literally hundreds of social media posts celebrating the murder of Brian Johnson, I was simultaneously disgusted and enraged by what I was reading. I know that health insurance executives aren't popular, but I had no idea how many people actually wanted them dead. And that made me angry. Why does it make me angry? Because clearly there are millions of Americans who detest our current for-profit healthcare system, particularly the health insurance companies. And yet, Medicare for All was a non-starter in this year's presidential election. It's a non-starter in the Democratic Party. And nobody other than the Democratic Party is going to give us Medicare for All. Wasn't discussed, wasn't brought up at all. Not during the debates, not even a public option. Nancy Pelosi became Speaker again in 2019. And in December of 2020, right after Democrats kept control of the House, remember, Joe Biden won and Democrats kept control of the House and we won the Senate and the White House, there was something called force the vote. Force the vote on Medicare. Force the vote said, look, Democrats have Biden in the Oval Office, Pelosi as Speaker, Schumer, Democrat running the Senate. We control all three. Why not force the vote on Medicare for All with the new Congress when it convenes on January 3rd, 2021? Introduce Medicare for All. This was 4 years ago. You might remember 2020 was the same year Bernie Sanders almost got the nomination, running pretty much on one thing, Medicare for All. COVID at the time raged through the community, and the inadequacies of our for-profit healthcare system was laid bare for everyone to see. There was an appetite for Medicare for All because of Bernie. But after the election, Pelosi said she would not introduce a Medicare for All bill because she knew it wouldn't pass. And she said it was her policy never to introduce a bill that doesn't have the votes. It's called the Hastert Rule. It was made up by Dennis Hastert, the Republican Speaker, who said, I will not introduce a bill unless I know it will pass. Dennis Hastert, child molester, went to prison for child molestation. Nancy Pelosi obeying the Hastert Rule. She's obeying a rule handed down by a Republican child molester, Dennis Hastert. Google it. Now, there were some rabid Bernie bros who said, let's force the vote on Medicare for All. I was one of them. I said, doesn't matter if it won't pass. We need to know the names of the Democrats in the House and the Senate who won't vote for Medicare for All now, so we can begin the process of primarying them in 2022 to punish them, to get rid of them. Well, 2 years later, in 2022, Pelosi had to hand the gavel to Mike Johnson. Actually, it was 2023. She lost the gavel in 2022. January 3rd, 2023, she gave up her speakership. Mike Johnson became speaker. Medicare for All was never voted on. Never voted on. Although I don't like a lot of people who were behind forcing the vote on Medicare for All, especially scam artists like Jimmy Dore, I agreed with them. I agreed with Jimmy. Medicare for All is the issue of our time. Health insurance companies suck money out of our healthcare system. They return nothing. They rob patients, loved ones, and doctors of something even more valuable than the $1.2 trillion they bring in each year, and that is our time. They steal our time. They make us sicker. They make us sicker. But I was told by the adults in the room, including AOC, that I was acting like a child, that I needed, and the force the vote people needed to be patient. The cooler heads prevailing inside the Democratic Party said, if we force the vote now on Medicare for All will lose in our democratically controlled House. And then once it loses, we will never get a chance to vote on Medicare for All again. That's what I was told by really smart politicians who I contribute money to, and by really smart pundits whose Substacks I subscribe to. I was told, David, you're being impetuous. Hold your fire. We have a chance for Medicare for All eventually, just not now. Plus, Joe Biden just got elected, and he's talking about a public option. Granted, a public option isn't Medicare for All, but it is the government, David, providing an alternative to private health insurance. You have to be patient, David. Don't make them vote on Medicare for All. It was explained to me, things like this take time. If we listen to you or Jimmy Dore and we're rash and force the vote, again, it will automatically lose in the House, and this is what they said. It will lose in the House, and then we'll have to wait 20 years for another chance to vote on Medicare for All again. And I asked, who says we have to wait 20 years? Is that a rule handed down by the parliamentarian? You only get to vote on Medicare for All once every 20 years? Because I'm pretty certain Republicans voted, and I'm not making this up, 100 times to overturn Obamacare since it was passed in 2010. So you're saying Republicans can hold 100 votes against Obamacare, but Democrats only get one vote on Medicare for All every 20 years. Is that what you're saying? And I was told I didn't know what I was talking about. I sound like Jimmy Dore. You don't understand. These things are complicated. So, of course, force the vote never happened. And like I just said, the Democrats lost the House within 2 years. Not that they didn't accomplish a lot during those 2 years. And I didn't expect Medicare for All to pass. But I wanted to know who the other Joe Manchins are in the Democratic Party. I want to find out who would vote against Medicare for All so we could get rid of them, or at least begin a debate. Again, I was fine with Medicare for All losing in 2021 in the House. You do it to smoke out phony Democrats and get the conversation on Medicare for All going. When it comes to Medicare for All, this is a matter of life and death. And when it comes to matters of life and death, I don't know about you, there are no gray areas. I know there are if you run a health insurance company. But for me, you're either with us or against us. You're either for Medicare for all or against Medicare for all. And if you're against Medicare for all, you're evil and stupid. Not to be discussed, not to be debated. If you're against Medicare for all, you're evil and stupid. Period. End of discussion. You cannot make the case against Medicare for all. Can't be done. You will lose the argument. So the health insurance lobbyists, Nancy Pelosi and Chuck Schumer, don't allow the debate because they will lose it. Medicare for all costs less than for-profit health insurance. It costs patients, doctors, hospitals, and the government far, far less. That's a fact. And if you don't know that, you're ignorant, evil, and stupid. The Congressional Budget Office has said this repeatedly. So does every top economist who's not being paid by the health insurance lobbyists to say otherwise. This is a fact. When you take health insurance companies out of the equation, then at least $1.2 trillion is automatically pumped back into our economy. It provides health care. It allows doctors to perform more procedures. It allows hospitals to hire more nurses, more doctors. They can build new treatment centers in the inner city. The only argument against Medicare for all, and apparently for some this is convincing, the only argument against Medicare for all is Medicare for all would put health insurance companies out of business. That's the same argument for not doing anything about climate change or ending wars. In America, millions of Americans must die to protect the profits of a few. I don't know. Maybe I'm insufferable, but it seems kind of unfair. Now, health insurance companies are different from fossil fuel companies and our military-industrial complex. I'm not going to defend Exxon or Raytheon, but there is some justification for fossil fuel, and there is justification for some military hardware. You can make a way more convincing argument for the utility of the internal combustion engine or Iron Dome or an anti-ballistic missile than you can for health insurance. People need cars, and like it or not, countries need to defend themselves. But nobody needs a health insurance company. In fact, health insurance companies are a disease. They are like an arterial blockage that must be gotten rid of. There's nothing good about a health insurance company. All they do is extract money out of our system by letting people die. Now, I have friends who are Democrats, and I've asked politicians on this show, tell me the value, make an argument against Medicare for all by telling me the value of health insurance companies. And I am told they create jobs. They're part of our economy. That's the defense of health insurance companies. They say, I know, these are Democrats. I know in the best of all possible worlds, we'd have Medicare for all, but health insurance company, they're an industry that needs protecting. They create jobs. So do the Mexican drug cartels. Health insurance companies they're like business managers. The only reason business managers exist is to rob you. Business managers lull you into a sense of complacency, and then one day you wake up, your taxes haven't been paid, and Kevin, your business manager, is living in Costa Rica. Anytime somebody says to me, I have a business manager, I say to them, you're broke. You're broke. And that's what you don't know you're broke, but if you have a business manager, you're broke. And that's what a health insurance company is. It makes you think someone is protecting you, protecting your money, because this is what we're talking about. We're not talking about health. We're not talking about healthcare. We're talking about money. Health insurance companies are about protecting your money. And you think you're being protected, and you can continue to believe that right up until you get sick. This is why the Democratic Party ran 20 candidates 4 years ago to drown Bernie's message out, which was Medicare for all. During nationally televised debates sponsored by the Democratic Party, Bernie literally had to shout over 19 other candidates, unable to make the case for Medicare for all. They wouldn't allow it. The Democrats wouldn't allow it. Now, Medicare for all would be more popular than it is, but there hasn't been a discussion or a debate except for Bernie. I've gotten pushback from some of my listeners when I say repeatedly that Medicare for all doesn't poll all that great. And I blame myself. I blame people who are for Medicare for all for not pushing hard enough for it. I don't blame Bernie. I blame the people who are for Medicare for all. I blame us for not fighting hard enough and making the argument. This is a fact. Medicare for all doesn't poll as well as it should. According to KFF, some polls on Medicare for all have shown that about 50% of Americans say they want Medicare for all or government-provided health care. But the polling is all over the map on Medicare for all because it has to be explained to the people being surveyed. They don't know what Medicare for all means. This is a serious problem. How many of you understand what Medicare is? How many of you understand what Medicare Advantage is? How many of you know that Medicare Advantage is the great ripoff of the 21st century? Do you know what Medigap is? Do you know what Medicaid is? I read this stuff all the time. It's very confusing. This is why Medicare for all doesn't poll the way it should. Bernie was running against, 19 other clowns 4 years ago? He couldn't be heard. Medicare for all that year, 2020, the push to force the vote started in 2020, January 3rd, 2021. Medicare for all wasn't voted on in the House. There was no debate. There was no discussion. If there's no debate in Congress, if there's no debate about Medicare for all in a presidential race, then the media doesn't debate it. The media doesn't cover it. Americans don't get to hear the pros and cons. So to my listeners who correct me and say Medicare for all is popular, I say, I wish you were correct. But we are all doing a crappy job, including me, making the case for Medicare for all. Now, Medicare for all is popular in what are called push polls when it's explained to people. But it's unpopular in push polls that portray Medicare for all in an unfavorable light. That's where the pollster says, well, are you still for it if you know that Medicare for all will increase your taxes? Are you still for it if it means the government is in charge of your health care instead of a corporation? And a lot of people hear that and they go, no, I'm against it. A lot of Americans who've never had a deal with, they're young or they've been healthy and never had a deal with UnitedHealthcare, they're convinced that a corporation can handle your health insurance better than the government can provide health care because they've never been sick. They never watched a loved one die because their loved one couldn't get prior authorization from a health insurance company. Putting health insurance companies out of business, which is what Medicare for all means, it doesn't poll well among healthy people who have never had a deal with a health insurance company. They think UnitedHealthcare, Aetna, they spend billions on lobbyists and advertising. They convince you that they're providing health care instead of preventing it. And that's a fact. They prevent health care. They don't provide it. So this is why shooting healthcare CEOs is a horrible idea. It's lazy, and celebrating their murder is lazy, stupid, accomplishes nothing, and makes Medicare for all that much harder to achieve. I always talk on this show, when it comes to politics and policy and government, you have to know what you want. If you don't know what you want, then you're just going to react to whatever Donald Trump says or whatever happens in the news. Again, this alleged shooter doesn't interest me. I don't care what his motive is. A friend of mine said, well, what do you think his motive is? And I say, will that give us Medicare for, if his motive was for Medicare for all, do you for 1 second think people are going to go, oh, then I guess we need Medicare for all if he shot a health insurance executive because it was for Medicare for all, then we better give everybody. What does it matter who this kid is and why he did it? He's just another asshole who got his hands on a gun. That's all he is. He's just an asshole with a gun. The answer isn't shooting healthcare CEOs. You got to know what you want. The answer is Medicare for all. That's the answer. All this anger that's come out towards the guy who was killed is of no value unless it leads to Medicare for all. We need to push for Medicare for all. Don't talk about the alleged shooter. Don't even talk about whether or not the guy who was killed, who he was. It doesn't matter. It has nothing to do with what I want, which is Medicare for all. We need to continue the debate on a much larger scale on Medicare for all. And again, it's an argument we can win, which is why they're afraid to have it. Again, it's why Nancy Pelosi would never bring Medicare for all to the floor. And it's why Bernie was drowned out on purpose during the 2020 presidential race. Despite that, he almost got the nomination. Do you know how hard the Obamas and the Clintons and Clyburn had to work to deny Bernie the nomination, and he was running basically on one thing: Medicare for all. See, Bernie knows what he wants. The Republicans will never support Medicare for all. That's why I blame the Democratic Party. It's their job to support Medicare for all. The Republicans, that's not their job. And it's precisely why Force the Vote back in 2020 would have been so valuable, because if you don't support Medicare for all, get out of the party. What are you doing in the Democratic Party? What are you doing in Washington, D.C.? What are you doing with your life if you're not fighting for Medicare for all? And again, Medicare for all means putting health insurance companies out of business. The problem with Kamala Harris in 2019 was she was for Medicare for all until she wasn't. She was not in favor of putting health insurance companies out of business. Medicare for all means putting health insurance companies out of business, not killing their CEOs, making them do actual work for a living. Do you know why Kamala Harris lost? And again, I would vote for her in a heartbeat. Kamala Harris lost because she ran on a platform of lowering healthcare costs instead of eliminating them. Democrats can't even bring themselves to say health insurance costs. They said healthcare costs. That's how deep in the pocket of health insurance lobbyists Democrats have cocooned themselves. The problem isn't health care costs. It's the cost of health insurance. Voters care about the cost of health insurance. So right there was the disconnect. Right there was why she lost. If you can't even bring yourself to say the words health insurance, how are you going to solve the problem that is health insurance? Healthcare isn't too expensive. Health insurance is too expensive. Donald Trump won because he's a liar. But he ran on promises he will never keep. But promises have some virtue because they tell voters what you're for, what you believe. Sometimes it's just as important to make promises as it is to keep them. Had Bernie Sanders won in 2020, but not gotten a filibuster-proof Senate, he probably wouldn't have given us Medicare for all. But I would know who to blame, and it wouldn't be Bernie. It's okay to make promises if you try to keep them. Trump is a liar. He's not going to keep any of his promises, but his lies told us what he's for and who he's against. Trump said, vote for me, and here's what I'm going to do. I'm going to deport 14 million immigrants. I'm going to make life miserable for other people and satisfy your bloodlust. I'm going to put tariffs on all foreign imports, and I'll lower taxes for 100 million voters. That's a platform and specific. None of it will come to fruition. If it does, then healthcare won't matter because we'll all be dead. The point is, you knew and you know who Trump is. You know who he's for, you know who he's against. He tells you who he's going to punish, who he's going to help. He tells you how he's going to do it. Tariffs, deporting people. It's all lies, but at least he means it while he's saying it. I believe he's a method liar. I think he inhabits the lie as he's saying it. And then after he says it, he realizes he doesn't mean it. So, again, it's very easy to beat up on Coach Waltz and Kamala Harris and Tony West and David Plouffe and the people who plowed through $1.5 billion in basically 2 months. It's too easy. But what was Kamala Harris's platform vis-a-vis Donald Trump? Vis-a-vis Joe Biden. I've gone over Joe Biden's platform. Very specific. What was Kamala Harris's platform? Joy. Okay. Lowering costs for health care. Lowering the cost of rent. Lowering the cost of a college education. Lowering the cost of food. Lowering the costs for everything that should either be free or almost free if you're broke. If you're part of the one half of America that can't come up with $500 for an emergency, food should be free, rent should be free, health care should be free, education should be free or close to free. And that's why Bernie ran specifically on Medicare for all, because it kind of makes everything else free. When you make health care free, you lower the cost for everything else, because free health care means corporations, companies, mom and pop coffee shops can pay their workers more in cash because they don't have to provide benefits. When you lower the costs for health care, you lower the costs for everything else, because free health care also means voters have more money to spend and they're not locked into a job. They're not locked into a job with a boss who justifies paying you crappy wages because, hey, I'm also giving you health care. And unions actually have to work for you if they're not the provider of your health care. How many unions are against Medicare for all? Because without the system that's been set up where they provide the health care for their workers, then they're going to have to negotiate better working conditions, better wages. By tying health insurance to the job, it creates a lot of complacency for CEOs and unions. We're locked in jobs because of the fear of losing health insurance. So, to my Democratic friends who say you can't put health insurance companies out of business because they're job creators, I say you don't know what you're talking about. They're not job creators. They're creators of indentured servitude. How many jobs have you stayed at just because you needed the benefits? How much crap have I eaten because I needed the benefits? And if you don't know this, you're either born into wealth and you're willfully ignorant, and that makes you evil. If you don't know this, you're either stupid, willfully ignorant, and in this day and age, I'm starting to believe stupid is evil. Again, I voted for Kamala Harris, and I would do it again. But there are seasons to politics and government, and we are entering a dark season, not the season of light, no matter what they try to tell you over at Macy's. This is not the season of light. It's a season of darkness. This is the season where the Democratic Party needs to point fingers. It's a time for bitter, cruel infighting. It has to be done. It purifies the soul. And we fight Donald Trump. But unless we start pointing fingers and try to purify the Democratic Party now, this is the season for distilling the party and boiling out the Pelosi's, the Schumers, yes, the Ro Khannas, who are worth $200 million. This is the time for infighting. Again, I defended Obamacare up until November 5th. If you listen to this show, I said there are seasons. This is not the season to criticize Obamacare. It's not before November 5th anymore. Obamacare is garbage. And I will say that throughout 2025 and up until probably April of 2026. And then I'll toe the line. It has to be said now that Democrats are controlled by the healthcare lobbyists. I wasn't going to say it before November 5th because the children were listening. I didn't want the kids to hear. But you know the Democrats are controlled by the healthcare lobbyists. That's why Pelosi didn't introduce Medicare for all for a vote on the floor. She was protecting herself and the majority of Democratic House members. She was protecting them from revealing who they're truly beholden to. And it isn't you. They're not beholden to you. They're beholden to the healthcare companies. Because the healthcare companies spend billions on lobbyists, campaign contributions, and you don't. It's 4 years since people called Pelosi to force the vote on Medicare for all. Again, in 2020, Bernie almost got the nomination running on one thing, Medicare for all. That was his signature piece of legislation. The same way Donald Trump says, vote for me and I'll hurt 14 million immigrants, raise tariffs. Bernie said, vote for me and I will provide you with free health care. Imagine if Bernie had been given the free airtime that Donald Trump has been given to demonize people of color, to demonize babies and women trying to come to America. Imagine if Bernie got half the free airtime explaining how Medicare for all worked. It would be a different country. Bernie said, vote for me. I will give you Medicare for all, and I will put the health insurance companies out of business. Out of business. Under Bernie's program, there would be a 5-year transition for health care, health insurance. They're not health care workers, they're health insurance workers. Medicare for All provides a 5-year transition period. So health insurance workers are trained to find new employment that contributes instead of takes from society. So look, when I tell people not to work for ICE. People write to me and say, I have a cousin who works for ICE. He's a sweet guy. You know, I have a cousin who is a pimp. He's a sweet guy. To me, Uncle Larry. I don't have a cousin who's a pimp. I've been very critical of people who work for health insurance companies because at some point, you must realize what you're doing. I've been told you need to be more sympathetic. Most of these people have no options. I understand that. And when I deal with people on the other end of the phone, when I talk to health insurance people, I slow talk them and then I lecture them about Medicare for all. I say, have you heard the good news? And then I start telling them about Medicare for all. And it eats into UnitedHealthcare's, or who, I won't tell you who my health insurance company is. I mean, there are ways to throw sand into the gears. And one of the ways is when you're dealing with health insurance people is waste their time. And I've said to some health insurance people over the phone, why don't you find other work? And one of them started crying and said she couldn't. So I understand. And I said to this person, you should still find other work. This is not healthy for you. But I do understand that people have to take jobs. I do. My Uncle Larry the pimp, he had a bad temper. Nobody else would hire him, so he became a pimp. My Aunt Miriam was his only bitch. That was it. It was not a healthy business model. I didn't have an Uncle Larry who pimped out my Aunt Miriam. He would lend her for cash, but not, no, okay. Do we have, there's nothing sympathetic about a pimp or a drug dealer. They'll tell you they have no choice. Mobsters will tell you they have no choice. We can excuse a whole swath of murderous behavior because someone was born into financial circumstances and they had no choice. I get it. But here's the truth. If you work for a health insurance company, this is the truth. You play a major role in the nearly 65,000 Americans who die each year because these Americans had health insurance. They kept their end of the bargain. They paid their premiums, but were denied the necessary prior authorization by the health insurance provider, the necessary authorization to keep them alive. Health insurance provider denied it, slow-walked it, and now they're dead. About 65,000 Americans each year die because of that. More people die each year because of that than Americans died in Vietnam. Hey, everyone's a victim. Nobody has free choice. No, you have no power over your destiny. I have to go work for ICE. I have to go be a health insurance flunky. Where does it stop? I have to separate families and put kids in cages. I understand. Your father left you and when you were 3 and you have no money. I'm sorry I made you feel bad about putting a 3-year-old in a cage. If you work for a health insurance company, you play a major role in the millions of Americans who go bankrupt each year due to medical debt. The number one cause of bankruptcy in America, health insurance companies. And they won't even say health insurance companies. They say medical debt. The number one cause of bankruptcy in America, health insurance companies. That doesn't mean that if you run a health insurance company that you deserve to get shot. Brian Thompson didn't deserve to be shot last week. And I'm not going to insult the intelligence of my listeners by pretending I'm appalled, shocked by the gleeful reactions to his demise on social media. I'm angry. I'm not shocked. And I'm not going to insult the intelligence of my listeners by telling you why it's not a good idea to shoot health insurance CEOs. A lot of ink got spilled in the past 5 days, telling people what they already know. You shouldn't shoot health insurance CEOs. You shouldn't shoot anybody. Okay, I'm going to insult your intelligence on why you shouldn't shoot healthcare CEOs. Because apparently, everybody knows you shouldn't. But I'm going to insult your intelligence by also telling you why you shouldn't celebrate their deaths. It's not a good idea to shoot a healthcare CEO. It's not a good idea to celebrate the killing of a healthcare CEO because it's not going to get us Medicare for all. In fact, it's going to make it that much harder to get Medicare for all. Because now Brian Thompson, the CEO of UnitedHealthcare, who was killed, and his ex-wife and his children, they're the victims instead of the hundreds of thousands of Americans whose lives are destroyed each year by Brian Thompson's company, UnitedHealthcare. That is what makes me so effing angry about the shooting, about the reaction, about the glee that was expressed on social media. It's why I folded up my laptop the morning he was shot, and I said, F it, I'm taking the rest of the week off. This is my first show back since the shooting. After this guy was shot, my first thought, we need to get these effing guns off the street. And then I wondered if he was shot because of what he does for a living. Then I thought if he was shot because he's the CEO of a health insurance company, that's not going to move the needle towards Medicare for all. That's going to be one more distraction, one more reason not to discuss Medicare for all. A man was killed last Wednesday. Was he a good man? No, not a good man. How do I know he wasn't a good man? Because he was the CEO of UnitedHealthcare. That automatically makes you a bad person. But that doesn't mean you deserve to be killed. On the last show, I talked about a Wall Street Journal investigative report detailing how nearly half of UnitedHealthcare's profits, come from charging Medicare for services it never provides to our veterans. Half the profits. It was in I think I talked about it on Monday's show, my last show. half of UnitedHealthcare's profits, not revenue, profits, come from charging Medicare for services it never provides to our veterans. That's according to the Wall Street Journal. UnitedHealthcare convinces about 1 million veterans to sign up for their version of Medicare Advantage, and they give them some cash back. And then, when these veterans get sick, they go to the VA. They don't go to a for-profit hospital. They're not stupid. But because of the contract that UnitedHealthcare has with our government, UnitedHealthcare gets reimbursed for medical procedures provided free of charge by the VA. It's in the Wall Street Journal. Somehow this is legal. So no, Brian Thompson, the CEO of UnitedHealthcare, didn't deserve to get shot. Nobody deserves to get shot. He deserved to have been locked away for life. There were some other things that I don't know if he was guilty of in terms of insider trading, but ripping off the VA, you should be locked away for life. It's pretty hard to imagine anything worse than stealing from our veterans. But UnitedHealthcare found a way to do something even worse. They delay, postpone treatment for sick children with cancer. They take their time on prior authorizations, betting the kids will die before they have to approve the medicine or the operation that will keep that kid alive. That's worse than exploiting our veterans. And what makes this even more loathsome, the parents of these children spend their last months with their dying kid fighting on the phone with a faceless bureaucrat working for UnitedHealthcare. And doctors who should be treating children with cancer are instead on the phone with faceless insurance bureaucrats who are not doctors, but they're preventing actual doctors from practicing medicine. You all know this. And social media was rife with charts all week showing that UnitedHealthcare was the leader in denying treatment. That is killing someone. When you deny treatment in the name of profit, that's killing somebody. It still doesn't mean Brian Thompson deserved to get shot. And it doesn't make the guy who allegedly shot him, who was arrested yesterday and charged with his murder, doesn't make him a hero. It makes, if he's guilty, it makes him a scumbag. Just another a-hole with a gun. That's all he is. It doesn't matter what his motive is, why he did it, because it's not going to get us Medicare for all. So I'm not interested in him. And the round-the-clock coverage of this alleged shooter is pornography, and it deflects away from what's really important, Medicare for all. You got to know what you want. Now, if I, for 1 second, thought shooting to death one healthcare CEO would deliver Medicare for all, I would still oppose shooting to death that one healthcare CEO. But if the killing of Brian Thompson, the CEO of UnitedHealthcare, somehow served as that proverbial wake-up call, and health insurance companies and members of Congress all said, hey, you know what? Until this guy got shot, we didn't realize how evil we are. But now that he's been killed, hey, you know, we are the only nation in the industrialized world that allows health insurance companies to skim as much as 30% off the top of all healthcare expenditures. We really, I mean, I didn't realize until Brian was shot that we provide nothing other than paperwork and eventual death. I have to say, we're going to stop. We're going to support Medicare for all, and we're going to put UnitedHealthcare out of business. I have a-hole friends who said that to me, not exactly, but this is the wake-up call. They're going to be scared. Yeah, right. They're just going to get more isolated and hire more security guards. But if this killing of Brian Thompson resulted in Medicare for all, I would still say it wasn't worth it. I would still say that. But it's never going to happen. And that's what makes me so angry. And it's why I took the week off. I was disgusted by the laziness, not just in the shooting of the healthcare CEO, if the killer was in fact angry about the way he was treated. I was disgusted by the reaction on social media, how lazy it is, because this isn't going to put the health insurance companies out of business. The issue now, this morning, isn't Medicare for all. The issue is safety for health insurance executives. The conversation isn't even about guns. That ship has sailed. Maybe a little conversation about what would make somebody want to kill a health insurance CEO. Maybe a little conversation about what would make millions celebrate the death of a health insurance CEO. But the real issue is Medicare for all, and that's never going to get discussed. And they turned it into crime on the streets. That's what I'm hearing mostly about, crime on the street. And is it safe to visit New York? And most importantly, the lack of civility on social media, the coarsening of our public dialogue, all the hand-wringing and bedwetting about the reaction on social media, how people unabashedly celebrate the murder of a CEO. What kind of nation are we? A nation that allows health insurance companies to skim 30% off the top of all healthcare expenditures and kill 65,000 people a year just to deny them the medical procedure they need. That's the kind of country we are. The problem isn't the coarsening of our dialogue. The problem is we don't have Medicare for all. One of the things that surprised me was some friends who took to social media. I have some comedian friends who went into the clubs, went on their podcasts and made jokes celebrating the murder. So I'm going to provide, how are we doing on time here? Okay, I'm going to wrap it up. Some of you have not had the benefit of good parenting. So let me share with you the proper public reaction to events like this So in the future, you don't get fired from a job. People don't think you're a sociopath, and you don't have to scrub your social media if and when you ever decide to start dating again. I mean, some of the things I saw, I'm thinking, don't you know that your people, before they go out on a date with you, they check your social media? Who wants to go out with somebody who is trashing the children of, anyway. Okay. So I think this is kind of important. I think it's a public service. It's okay to have dark thoughts. It's not okay to act on them, and it's not okay to share them in public. There are jokes that make me laugh really hard. The jokes that make me laugh the hardest are jokes that punch down. Not up, down. What makes me laugh really hard are easy jokes that punch down. Am I proud of that? No. But I'm an animal. I'm human. Jokes that punch down are funnier. When I was very young, my father and I would watch Monty Python. And John Cleese in Monty Python, there was this episode, this sketch where he played a brain-damaged boxer. It was on the margins back then of the way he played this brain-damaged boxer. It was funny. And this boxer would train for fights by getting on his knees and rubbing gravel in his hair, and he was brain damaged. And the big fight he had was against a 90-year-old woman. And I was very young when I saw this. I was watching with my dad, and John Cleese, God bless him, is this brain-damaged boxer, and he gets into the ring with the 90-year-old woman. The bell rings, and they start fighting, and within seconds, John Cleese delivers a roundhouse that knocks the 90-year-old woman flat on her back. My father and I, we laughed so hard. I don't remember the rest of the sketch. I've seen it a million times since, but I was a kid, and I assumed the old lady was going to beat up the brain-damaged John Cleese. And what Cleese taught me from that is punching down is way funnier than punching up. Or maybe he taught me the element of surprise. Maybe that's why I laugh so hard. Maybe there's something wrong with me. Maybe punching down isn't funny. Maybe seeing a 90-year-old woman getting punched isn't funny. The point is, laughing at a 90-year-old woman getting punched. Well, it was done in public, but for the most part, it's okay to think it's funny. You just don't laugh at it in public. You laugh at it in private, right? Like I'm falling and I can't get up. I've fallen and I can't get up commercials where the woman is crying. You can laugh at that privately with a friend, but not publicly. There's a time and a place to enjoy the suffering of others. I enjoy filthy jokes that are mean, cruel. I love jokes that are cruel for no other reason than celebrating the cruelty of it all. But, and this is where good parenting comes in, you don't tell these jokes, at least you shouldn't, in public. These kind of jokes are what close friends tell each other. It's like a secret. I can trust you with this. Here's a joke. It's horrible. But I can tell it to you because I trust you. You won't think less of me. It's an exercise in bonding. So, when the CEO of UnitedHealthcare got killed, there was an entire spectrum of thoughts everybody had. Some of them were good, some of them were bad, and they were inside us. There were the thoughts that are appropriate, and there are the thoughts that are not just inappropriate, but wrong, not fully fleshed out, flowing from our lizard brains, and better left unsaid. It's okay to have these bad thoughts. It's not okay to act on them, and it's not okay to share them in public, especially on social media, in a comedy club, or on a podcast. So when someone, like a health insurance CEO, gets shot, you're going to have a whole spectrum of thoughts. It doesn't benefit anyone, especially yourself, to share the bad thoughts. It's okay to have dark thoughts. We're animals. We all have horrible thoughts. But keep them to yourself. Or if you have a loved one or a close friend, say, hey, I know I shouldn't think this. I know I shouldn't say this. But I can't help it. A part of me feels that maybe blah-biddy, 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 blah. That's what friends and loved ones are for. But it's not a good look to share the bad thoughts on social media, on stage in a comedy club, or on a podcast. And when I saw the reckless abandon with which some people who I know reacted to this tragedy, and yes, it is a tragedy, I kept thinking, people need parents. People need good parents. People need Medicare for all and good parenting. And I think we'd have Medicare for all if we had better parents in this country. I'm David Feldman, reminding you to stay strong and protect the weak. Thank you for putting up with me. I wanted to get this off my chest. I don't know if anybody cares, but I care deeply about Medicare for all. And if you know what you want, you'll block out all the noise and fight for Medicare for all. Please share this episode. That's the best way to help me. Please like this episode so I remain in your feed. Thank you to Bob, Mila. I don't know if Leonard, my nephew Leonard, I think is a moderator now, in the chat room. Please leave a comment. I read all your comments. Please check out the garbage over at shopdavidfeldman.com. This has been the Mop Up for, December 10th, 2024. I'm back. I'll do a show early Thursday morning. Thank you.